Israel's Supreme Court has allowed aid agencies to continue working in Palestinian territories for now. In December, the Israeli government ordered 37 international organisations to stop work in Gaza and the occupied West Bank within 60 days unless they agreed to new rules.
A number of aid agencies, including groups such as Médecins Sans Frontières, outlined their concerns in a petition to the Israeli High Court of Justice, warning of devastating humanitarian consequences if they had to cease operating. Tim Roth is the Executive Director of MSF Australia and New Zealand and is with me now. Very good morning to you. Thank you for your time.
Good morning, Catherine. Thanks for having me.
So it seems that MSF, amongst others, has been given a reprieve for now. What is your response to last night's court decision?
We welcome that development. Obviously, it's too soon to see how the Israeli authorities will interpret that decision. As of yesterday, we've removed our international staff from Gaza and the West Bank. We continue to operate. Obviously, 80% of our staff are Palestinians. We've been working in Palestine since 1988, and we will continue to operate there for as long as possible.
Before we look into more detail of what a decision, if you were unsuccessful, would mean to aid and people who live in the region, this is a temporary injunction. As you mentioned, the court is looking at the petition. What will the court decide now around this? What exactly is it looking at?
What we've petitioned is that there will be a humanitarian collapse if this goes forward. MSF provides, amongst other people, 1 in 5 hospital beds, 30% of safe deliveries. We provide 800,000 outpatient consultations, so a significant part of the healthcare system. Obviously, 80% of buildings have been destroyed, the healthcare system has been destroyed. So if this goes ahead, there would be a humanitarian collapse, and that is what they're weighing.
Just for some context, Tom, people who might not be across the story entirely, can you take me back to December when Israel requested some of these aid groups to stop work in Gaza and the occupied West Bank within 60 days, unless they agreed to some new rules? What were those rules?
So the Israeli authorities, as part of their registration process, have asked for our staff details, and we have been in ongoing negotiations with the Israeli authorities about safeguarding and how they would use those details. And we have been unable to get from the Israeli authorities assurances about how they would use that data so that we can safeguard our patients and our staff.
So your decision to safeguard comes from where? What evidence do you have or suggestions that you wouldn't be safe if you were handing over the details of your staff?
There is constant pressures on the communities of Palestine and the staff in Palestine. So we have serious concerns about how data will be used. And then there's the fundamentals of humanitarian assistance, that we should be able to provide unimpeded humanitarian support in a humanitarian disaster.
Can we go to, if the ban goes ahead, there's some 38 aid groups that will have to leave these areas. Where will that leave the people of Gaza and those in the West Bank?
In a catastrophic situation. It's distressing. Obviously, 80% of buildings have been destroyed. The water and sewerage system has been destroyed. The healthcare system has been destroyed. MSF and other agencies have been attempting to meet this need. As I've mentioned, we provide 1 in 5 hospital beds and 30% of safe deliveries and a significant proportion of the medical care. There's daily violent injuries coming and deaths coming into our hospital. So obviously that would be catastrophic if that was stopped. Already, since January, we have not been able to get staff or supplies into Gaza, and that is restricting our ability to respond.
What is your understanding of, when you're speaking with people from MSF there, what is your understanding of how the ceasefire, which was agreed to late last year, how is that operating?
The ceasefire hasn't changed the situation on ground. As I mentioned, 80% of the buildings have been destroyed. The healthcare system's been destroyed. Hundreds of thousands of people are in need of medical and mental health care. That situation hasn't changed. There hasn't been an ability to get unimpeded humanitarian assistance in. As I just mentioned, since January, we have not been able to get staff and supplies into Gaza. So it's still a catastrophic situation.
We know that the borders, since that ceasefire was struck, are open in some cases. The Rafah crossing, where aid is meant to come in and out, is meant to have the flow of people as well. Are you seeing anything come through these corridors? Because the Israeli government says that aid is coming through.
We are not able to get aid in. We are seeing, and it's been reported elsewhere, that even medical evacuations are not going through. It's reported that it would take 10 years to get just the urgent medical evacuations of children through the Rafah crossing. So clearly there is not an ability to scale up, nor even provide the immediate assistance that's required.
Tom, just finally, do you have any sort of understanding as to how long the court will be weighing up this petition and where they will land?
No, at this stage we don't have any understanding of that. I see it in a positive sense in that there's a moral and a legal obligation on the Israeli authorities. It's positive that we've had this injunction, and we would expect that the international community and the Israeli authorities take it on board, and that we will see unimpeded access into Gaza.
Tom Roth, Executive Director of Médecins Sans Frontières Australia and New Zealand, I really appreciate your time this morning.
Thank you.